Actually, I'm Dr. Raju Dakal. I'm physical medicine and rehabilitation, and trained in spinal cord injury medicine and rehabilitation from different parts of the world. So currently, I'm working as a medical director and consult physician at Spinal Injury Rehabilitation Center, which is a non-profit specialized rehabilitation hospital, 51 beds for spinal cord injury and 10 beds for acquired brain injury. I'm involved here more than 13 years. So actually, I was interested in the field of rehabilitations because I had post-polio paralysis when I was 2 years old child, and then when I did my internship in Bachelor of Medicine and Bachelor of Surgery, I found there is huge gap in the healthcare structures, because once you have chronic conditions, there is no place to care, and you have to go to directly home, and and then you die. So then I realized, this is the field that I should choose at the rehab medicine, and then I choose to do my residency in Bangladesh for the physical medicine rehabilitation, and became the first the PMNR, physical medicine and rehabilitation of the country.
My name is Hari Adhikari. I've been working at SIRC since 2018 as Administrative Director. I have a basic knowledge of telemedicine when I was working in other hospitals in the past years. In 2019, our medical director, Dr. Raju Dakal, said about the telerehabilitation services to me, which is a very exciting moment for me. Mainly in telerehabilitation project, I involved for telerehabilitation equipment setup, communication, coordination, and necessary administrative works.
So actually, the main challenge is rehabilitation is still not integrated in healthcare system, because it is not prioritized at policy and political level. However, there are few health-related action plan and guideline have been developed by the government of Nepal. That is basically after 2015 earthquake and after the COVID. So this is the main challenges I found. And the next challenge is very limited resources of the rehabilitation professionals, and the service delivery mechanisms for the rehab. Also, we do not have, academia to develop, human resources and other resources. And next is the finances for the rehabilitation. And third, a challenge I found is like socioeconomic conditions and the geography of the country. So three are the main challenges I found for delivering specialist rehabilitation in Nepal. Yeah, I think before that, I'd like to tell you about the Nepal. Nepal is a small, landlocked, and mountainous, a low-income country with diverse geography and mountains, hills, and plain region. So there is huge unmet need of rehabilitation for people with impairment, disabilities, aging, non-communicable diseases, and injuries. Uh, yes, there is a national e-health strategy. They have also mentioned that the rehabilitation has to be delivered through this telerehabilitation system, but the implementation was an issue. So I can give you one example, like, I mean, once they discharge from our especially rehab center, the majority of people never come for follow-up, and if they arrived for follow-up, they already develop a lot of complications, and they at the end stage of life. And even for follow-up is very expensive. Transport is not accessible. They need to have a company with their caregiver. So I have one example I can give you. For the simple follow-up consultations, one woman from far western region who had spinal cord injury and a fractured leg, and it cost for her for 40,000 Nepali rupees, and 4 days with two caretaker. So actually, that's for simple consultations, and when she came to our center, it cost the center cost, including the consultations, therapies, investigation. It is only around 1,000 Nepal rupees. So you can imagine what are the direct and indirect costs for the any citizens of this country. And these are the eye opener for the concept of telerehabilitation in Nepal. And it is even that cost was even maybe 2 times higher than the average income of Nepalese people. So that's why I was thinking, we were thinking of how can we increase follow up to the patient who discharged from the center. And then, at the meantime, I had contact with Dr. Manoj Sivan from University of Leeds, Academic Department of Rehabilitation Medicine. Then we had a series of meeting, and then we decided to go for a grant for Global Challenge Research Fund, Research England. So then University of Leeds and Spinal Injury Rehab Center collaboratively, applied for the TEleRehabilitation research grant. I'm very fortunate that we got that project. And even it was like a project, but it's the project finished. We use TEleRehabilitation as one of the continued services of the center. So I told you, like, when I see, I lost so many patients in follow-up, and when I interview with the patients, their caregiver, the main thing is like once they discharge from the center, they couldn't come because of geography, disabilities, financial issues. They need a caretaker to come with them. Sometimes they don't have that. It's and then I thought, why do we spend huge resources, in the pre-hospital care, hospital care, even the rehabilitation care, if they have to die within a month without having, the good medical rehab care? It was my mind, and I was thinking, how could I, if they can't come to us, how could we reach to them? So, and then, one of the professors from India, from AIMS, he connected me with Dr. Manoj, and he and myself were talking about, there is a call for the Nepal and the England, and how could we work together? And then I talked to him like, these are the main concern to me for my patients and my control system. And then I explained to him, and then we decided, okay, let's go for the telerehabilitation, so that if we can have our setup in the center, and also we can provide services, and still, and also there is no such study has done in our setup, like whether this telerehabilitation is feasible or acceptable in low middle countries. And so in that way, in one sense, like it's services to the needy people. And next is, we also want to produce, some evidence so that this type of services would be, ideal in the country like Nepal. So, and also, after this project, we were thinking that this is a pilot project, and the pilot, and then in the future, if this is acceptable or feasible, we can expand this type of send services to the all over the Nepal in collaborating with the Ministry of Health and Population. So this is the story behind that, Chad. So actually, TERN project was like a 6-month project, and we uh, we started this project to the patients or people with spinal cord injury and acquired brain injury who got rehabilitated from our centers and discharged to the community. So we took like the discharge 18 month of who had already discharged and within 18 months been in the community. And also we then we set a multidisciplinary team of rehab doctors, physical medicine rehab physician, physiotherapist, occupational therapists, rehabilitation nurses, um, and the social worker, and in need in case of need we have prosthetic orthotists as well, and definitely all the entire SRC team. Then we design like the social worker they just list the discharged people within 18 months, and we call them from the telephone whether they like to involve in our project or not. And then we took a verbal consent, and then after taking verbal consent, and we choose like at least they take at least 1 day of travel is a strict criteria to come to the center, and also more than 18 years of age and who are willing to participate in the project. And then the social workers who is very trained, and our team UK team from University Leeds and the Sheffield, they went to our social worker to the community, and they trained them the social worker how to take the all the information and data of our telerehabilitation intervention. So then the social worker he visited to the patients the community, and then he first put the baseline data of their physical outcome, their physical functions, and then we use modified Barthel index, and for the psychological we use dash 21, and for the quality of life we use EQ5D quality of life questionnaires. So then he come with us, and that was our baseline outcome, and then we started and we found their main issues, the problems, and we set the goals and through the TEleRehabilitation system, and then we applied our intervention. So after intervention, we uh, see their progress or outcome at least within 1 month, sometimes within a week or 2 weeks or 3 weeks, within 1 month we see their outcomes. The and we don't fill up the outcome. Actually, the trained medical social worker, he just interviewed and fill out the outcomes. So, and then this is the overall the methodology or scenario of the TeleRehabs in Nepal project. So with this project, sorry, I like to add one thing. Like here, what we did, like we didn't just do the research, rather we provided them the if we found, let's say, uh, some deficiencies, or if they need some assisted products or medicines, we or even if they are in the situation that they need to have a specialist rehab care. I mean, we admitted them at the centers with this fund from the project, and also we provided them some wheelchairs, medicines, like catheters, such type of things as well. We had contact with around 200, I should say, but few people they already died, and few people are unreached, and the few people they are not interested because they do not have any problem. So altogether, our inclusion exclusion criteria, we did telerehabilitation intervention for 97 the people. The 82 were spinal cord injury, and 15 were the acquired brain injury, including stroke and traumatic brain injury.
Mm. Our center also, in our center also COVID-19 outbreak. Uh, and it was, we have a very challenging experience in that time. But in COVID-19, face-to-face consultation was is very difficult for the other healthcare setting also. But in rehabilitation center, mainly in our centers, we provide services for the spinal cord injury and brain injury. When they are discharged at home, and in this COVID time, if they want to travel to the health center also, it is really challenging for them to be in the center. So they, when they have a complication, they have very easily contacted to our centers, and our doctors, our multidisciplinary team, they provided services from our center, and they are in their at their home. And mainly in the telemedicine, some other centers, sometimes the services from the one health center to the another health centers, they have a communication. But in the telerehabilitation, we directly contact to the patients or who need the services from our center to their home. So in COVID-19 period, it in my perspective, it created the more value or importance of the telerehabilitation or telemedicine, not only in Nepal, I think in the world also.
So, yeah, so I mean, future specific rehabilitation is, I should say, is a long-term dream, and I do not know when and where it exists or not still. So, so yeah, there are some guidelines and action plans already, and somehow the government has realized that every trauma center has a rehabilitation center. I don't know whether it would be specialized or not. And also they have envisioned that the rehabilitation services should be available at the primary healthcare level. So, because of our socioeconomic and geographical barriers, uh, it's very difficult to get the optimum level of especially rehab services in Nepal. So in that way, the telerehabilitation system would be ideal, for the especially specialist rehabilitation for medical and therapy intervention, screening and monitoring as well. And then one thing, like the specialty rehab center can be delivered in different way. So our TERN project demonstrated that there is this type of services is feasible and acceptable, and it has also enhanced the physical, psychological, and definitely we need to do such type of study in other conditions as well. So this would also helps to have set up for the special rehabilitations in Nepal. Yeah, at the time of turn, I was the only one, but now we have another two physical medicine rehab doctors. One is working in my center, and another is working outside the country. So we all, including myself, now we are three rehab doctors. But at the time of starting this, project, we had only one female doctor. That's me. Yeah.
In the context of these low middle income countries like in Nepal, or even in, it's proved that in the pandemic situation, this telerehabilitation and telemedicine program is important. And um, the support to grow, support is needed to these programs. And right now we have been uh, the internet connection also increasing in the low middle income countries also internet access. So it is very useful, um, um, per this program. And also the cost wise also the is cheaper. And also sometimes it gets a free of service also, like we provide free of services. And right now we are using this mm, third party software like a Facebook, WhatsApp, and this other app for this telerehabilitation. And all, we also think that it is in future for the separate app or technology in integrate in the telerehabilitation, so that the we can also capture all this data safely of the patients. It is the next step. If any organization would like to collaborate with us for this telerehabilitation in Nepal, we are more than happy to collaborate with them. Thank you.
TEleRehabilitation, we have demonstrated that it's feasible and acceptable in low-income countries like Nepal, or even in high income countries where specialist rehabilitation service is not optimum level, and it would be useful for there as well. And the telerehabilitation approach, we have led to improve the patient's outcomes, and also it overcome the different barriers like geographical barriers, financial barriers to healthcare access, and it has no side effects or risks for that. And also, we need to explore more the digital interventions for health system strengthening. And also, this is the Spinal Injury Rehab Center is always, welcome, or we like to have collaborations with the institutions or people to expand this type of services in Nepal. Or even, we are very happy to provide you our experience if any people or any institutions in the world wants to have such type of system. So, Rose, thank you so much, University of Leeds, UK team, and also Zev, for your time and interviewing us. Thank you so much.